Assalamu alaikum. The long clinical consultation day. First scenario, Mr. John, 45 years old, presented with the complaint of hemoptysis for 2 months. His blood pressure 140/90. Pulse rate is 90. Please take history, examine the patient, address his concerns. Ready?
Hello,
Yeah, here you go.
I am Dr. Ahmed. I'm doctor in the clinic today. Can I confirm your name and age, please?
Right. Mr. John Smith, and I'm 45 years old, doctor.
Today we are here to discuss some issue related to your health condition, examine you and address your concern. Is it okay with you?
Yes, it's okay, doctor.
Uh, Please, can you tell me what bring you to the clinic today?
All right. Doctor, I've been feeling unwell for the past 2 months, and I've been having some blood in my phlegm, and I've been coughing. And it started like I used to have like one episode per week when it started. But then it started to get worse where I can have 4 to 5 episodes per week, and I started to feel more tired, and I'm really worried what's going on with me.
I'm sorry for that. Uh, can you tell me what amount of blood?
Well, it's not much. It used to be a little bit of blood in my cough, but
Yes, like a streak or like teaspoon.
it used to be some streaks, and now, like in the past 2 weeks, it started to get more like maybe a teaspoon of blood when I cough.
Okay. I'm sorry for that. Can you tell me about color?
So when it started to be like a white phlegm with a bit of blood in it. Now sometimes all I can get is blood. Sometimes it's mixed with my phlegm. That's
Okay.
all.
It start gradually over, as
Over
you mentioned,
month,
over
yes.
3 months, huh?
2 months, doctor.
2 months. Okay.
Yes.
Uh, is there any chest pain?
No, I don't have any chest pain.
There is cough.
Yes, there's cough.
Okay. So associated with this hemoptysis when you
Yes,
coughing?
yes,
Okay.
doctor.
Is there high body temperature?
I feel my body temperature is slightly high during the past 2 weeks.
Okay. Is there any weight loss?
Yes, I've lost some weight, doctor. So you're
Lumps
right,
or
I've
bumps?
lost weight. Oh
Okay.
no,
Can you tell me about weight loss? How many kilos
it
over
could
how long?
be it could be like 2 kgs during these past 2 months, doctor.
Okay. Is it intentional?
No, it's not intentional at all.
Okay. Is there any lumps or bumps in your body?
No.
Uh, is there any loss of appetite?
No, my appetite is okay.
Okay. Is there any shortness of breathing?
No.
Any heart racing?
No, doctor.
Okay. Um, uh, can you tell me, is there any past medical history should be aware of?
Um, I had tuberculosis in the past, maybe 4 or 5 years ago, and I was treated. I completed my treatment, and I tested negative, so all went well.
Okay. Um, uh, is there any history of similar condition?
No, this is the first time to happen to me.
Okay. 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 You taking any medication like I mean blood thinning medication?
No at all.
Okay, okay. Is there any recent infection?
No, doctor.
Okay, okay, okay. No any bleeding from any other side of your body, like nose, like from any from gut, like with vomiting, contain blood, or any other source of blood in your body from any orifice?
No, I haven't noticed any bleeding.
Okay, okay, okay. Is there any tummy pain,
No tummy pain.
tummy distension,
No,
a change in your bowel habit? I mean, hard stool or loose stool?
no, it hasn't changed.
Any throwing up?
No, doctor.
Any change in your water work? I mean,
No,
fluid urine or color, frequency,
no,
amount?
it did not
Okay,
change.
okay. Any joint pain?
No joint pain specifically, but I just feel some like weakness, maybe some aches in my body, but not specifically joints.
Okay, okay. Uh, is there any joint swelling?
No joint swelling.
Okay, okay. Uh, uh, is there any headache? Headache? Is there any headache?
No headache.
Memory problem?
No,
Vision problem?
no,
Feeling of weakness in your upper limbs or lower limbs?
no,
Okay. Is there any feeling of weather preference?
no other preference.
Any swelling in your anterior neck?
No,
Okay. Um, no any other history apart of tuberculosis. I mean, like history of any chronic lung disease.
no, I haven't had any problem with my lungs apart from this infection I told you about, tuberculosis.
Okay, okay, okay. Is there any family history of any uh, uh, bleeding problem?
No, doctor.
Okay. Um, can I ask you? Can I ask you some social question? Do you smoke?
Yes, I smoke.
Uh, as you know, smoking is harm for your health. So my advice to stop smoking. And if you are willing, I can help you by refer you to smoking cessation clinic.
Right, thank you, doctor.
Do you drink alcohol?
No.
Okay, that is good. Is this symptom impacting your life?
Yes, yes. Um, I've been feeling quite tired, and to be honest, the cough and this blood in my cough is really annoying me.
Okay, I'm sorry for that. What do you do for living?
I'm a farmer, doctor.
You are
A farmer.
farmer. Okay, you can take rest, and if you are employer, we can give you a sick note until we fix your problem.
Right, okay.
Okay. Um. So um. I want to. Do you have any concern?
I'm really worried, doctor. So I'm quite worried my tuberculosis. This could be related to my tuberculosis.
Yes. Uh, Most likely, this condition is related to your old problem of tuberculosis. Can you let me to examine you?
Yes, go ahead,
Then
doctor.
I can give you more information about your condition. and will be satisfied after that. After I finish the
Right. Okay.
examination. Okay. I want to examine hand
Okay.
for any
So
clubbing.
there is no clubbing.
Um, uh, and any colonychia, leconychia,
No.
any tremor.
No tremor.
Okay. Then I want to examine your eyes.
Yes. There is no pallor, no conjunctival pallor, no jaundice.
Okay. Okay. Mouse or any central cyanosis.
No.
Okay. Um Also, any gingival hypertrophy,
No gingival hypertrophy.
good oral hygiene.
Good oral hygiene.
Okay, and I want to examine chest,
Okay, go ahead.
inspection, any scar.
No scars in the lung, in the chest, sorry.
Then I will ask the patient to cough
Okay.
to see any asymmetry in the chest or give
Mm,
deep breaths in and out.
okay. Chest is moving equally bilaterally.
Okay, then I will do chest expansion.
Okay.
Uh, then I will do percussion
Okay.
on all chest, normal resonance.
Yes.
Okay. Tactile vocal fermitas.
Yes. So you find an area of increased vocal resonance in anteriorly in the right side.
Resonance.
Increased
Vocal
vocal
what?
resonance. Increased
Increase
vocal.
vocal.
Yes.
Okay.
Increased vocal resonance, and when you auscultate, you find an area in on that area bronchial breathing.
Okay. This is. Can you tell me what is this area in right upper chest
Yes, in
or
the right
or
upper chest.
left? Okay.
In the right upper
Okay.
chest.
Okay.
The rest of the chest examination and the bases of the lungs are all normal.
Okay. Okay. No basal crepitation.
No basal crepitation.
I will check also for lymph node enlargement.
No lymph node enlargement.
Then I will ask, is there any back pain? I will check for sacral edema.
No sacral edema.
Then I will examine for trachea deviation. Is
Okay.
there central or deviated to any side?
No, you find it slightly deviated to the right side.
Deviated to right side. Okay. Okay.
2 minutes left.
Uh, okay.
So,
I will.
doctor, yes, okay.
Tell me.
I'm quite worried about the recurrence of my tuberculosis, and I really want to know what's happening with me.
Sure. I highly appreciate your concern. Uh, uh, I suspected you have a condition, mostly, maybe a recurrent of TB, but mostly the complication of tuberculosis. Because sometimes tuberculosis can leave a complication in the lung, like cavities, can cause cavities in the lung. Uh, this is cavity sometime, if no infection, you will be no symptom for a long time. But sometime when your immune system become weak, some infection come and accumulate inside this is cavities, and this is called aspergilloma. This is type, don't bother by
Well,
this name, this is type of fungal
is
infection.
this
Can be a causes of your condition, the complication of tuberculosis. Tell me,
is this serious, doctor? Sounds like
it is serious if left
something very
untreated.
serious.
If left untreated, it will be
Right,
very
okay.
yes. And also other maybe
Is
you
there
have
any
also
medicine of the
yes, yes. There is some medication can be given, but before that, we need to proceed for you some investigation apart from blood test and some imaging and scanning of your chest to confirm the diagnosis. And after that, we will proceed for treatment. And also, you have another um, differential of your condition, other apart from
Okay,
this condition as I told.
time is up, Dr. Salma, sorry. Whatever you
Okay,
want to add as a differential, don't mention to the patient. Okay, you
okay,
give him a first differential, right? He's asking
okay.
for one possible. If you want to
Yeah,
mention others, keep it for the examiner.
okay.
Okay, now the examiner question, Dr. Salma, please. Dr. Lamis, sorry, start.
Please consolidate and give me your positives.
45-year-old present with hemoptysis, uh, 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 has a past medical history of tuberculosis last 5 years ago, and now has weight loss and also has this condition, hemoptysis, for 3 months. Uh, uh, on examination, there is increased vocal resonance and bronchial breathing over the right lung, upper chest, and there is also deviation of the trachea to the right side also. So my differential diagnosis is aspergilloma as a complication of tuberculosis.
Right. What other differential do you have?
Can be pneumonia, uh,
Pneu-
can be uh, uh, can can be bronchiectasis, uh, can be lung cancer,
Okay.
and
So
can be
this
lung
patient
abscess
was a
also.
smoker. Have
Uh,
you asked the patient about his smoking?
uh,
The patient mentioned he's a smoker. Have you
yes,
asked the patient about his smoking?
yes.
I mean, like for how long, how much he was smoking? Because
Yes,
the
no.
patient was
He,
a smoker for 20 years and he was smoking a pack daily.
okay,
Okay, so what
okay.
else do you want to keep in your differential diagnosis?
You
Asperger,
mean other differential?
yes, other differential.
Other differential can be pneumonia, can be recurrence of tuberculosis, can be aspergilloma, uh, can be also acute bronchitis, can be uh, can be upper respiratory tract infection,
Right, okay.
can be
Um,
lung cancer or lung abscess.
well, lung abscess for 2 months, you want to keep it.
Okay, sorry, long time. Okay, yes, lung abscess acute. Okay.
If you think about the symptoms of the patient, so the patient gave you a history of some mild weight loss, he have been having a mild fever, fatigue, some constitutional symptoms in the form of arthralgia as well, and his blood pressure also it was on the higher side. If you notice, was 140/90.
Yes.
Do you want to think of anything else? Do you want to put
Fever.
any form of vasculitis in your
Yes, can be. Yes, can be vasculitis.
okay. So how are you going to investigate this patient?
Apart from general investigation, full blood count, renal function test, liver function test, inflammatory marker, uh, specific investigation, chest X-ray, and CT of the chest also.
Okay, what else?
Bronchial pleural lavage can be done also
Okay.
for any infection.
Anything else you want to do?
Um,
Do you want to do anything for vasculitis? Any screening?
for vasculitis, apart from inflammatory marker.
Yes. Okay, how are you going to treat this patient?
A non-pharmacological treatment, education, counseling, multidisciplinary team approach, and by pulmonologist and uh, uh, specialized nurse. Um, then specific investigation according to the X-ray finding and according to the investigation.
Right, so how are you going to treat aspergilloma?
Aspergilloma, I'm not sure, but I think there is antifungal can be given.
Okay. So your definitive treatment will be surgical resection, the form of segmentectomy or lobectomy.
Yes, definitive treatment, removal of the fungal ball.
And
Or
if the
antifungal medication like itraconazole also can be given.
because the oral antifungal, they have a limited penetration into the fungal ball. But if the surgery is not suitable, then you can, to relieve your hemoptysis, you can do a bronchial artery embolization
Embolization, yes.
to control like
This is in massive.
massive hemoptysis.
Okay.
Yes, and the oral antifungals are reserved for the poor surgical candidates.
Okay.
Because they have limited. There's also intracavitary antifungals as well, but these are rarely used. And you will add your supportive treatment for any chest case, like I'll give oxygen if needed, vaccinations, any chest rehabilitation if needed. Okay, thank you, Dr. Selma.
Thank
I
you
don't
very much.
have more questions, Dr. Basim.
Okay, thank you, Dr. Lamis, for the case and the questions. Now you can comment based on the skills I wrote it. Since you are having exam, you and Dr. Lamis and Dr. Salma, sorry. So please to be trained on the skills. Okay. So comment on
Right,
her
okay.
performance based on the skills. Yeah. Here you go.
Right. So based on the physical examination, I think her physical examination was the identifying findings that were satisfactory because she was
Sorry, Dr. Lamis, can you repeat the physical
she
examination because
did
you have some breakdown.
a physical examination. So she did examine general examination, and she also examined for the lymph nodes. She offered the chest
Perfect.
examination, which was the main system to be examined. So two more things were expected is to offer the temperature because the patient mentioned he
Yeah.
had fever. So yes, the
The vital
temperature,
charts.
and it was written. Yes, it wasn't written. So just if you ask for the vital charts, you can see your
Perfect.
temperature, your respiratory rate. And because one of the differential diagnoses in this case is vasculitis, so offer a urine dipstick for any hematuria or proteinuria. For
So
RBC.
you're gonna give her borderline or satisfactory for the physical examination?
It's going to be a borderline because the
Okay,
case
she
was
missed some of.
calibrated for, yes, because the case was calibrated for vasculitis
Okay, go ahead. Identify the
as well.
finding.
Like the,
Yeah, it's
yes,
okay.
so identify the findings because she picked up the findings, which was mainly a cavity in the lung. So this satisfactory. Clinical communication, yes, satisfactory. I think there are like few things. Dr. Selma, I think she was a bit anxious or nervous because I think she covered the history, but again, she mentioned a lot of jargons. Like she mentioned hemoptysis to the patient, upper limb, lower limb. She also
Yeah, agreed.
mentioned,
Agreed.
yes,
So,
there's something
upper
like
limb
four things.
jargon.
yes, to the
والله.
patient jargon. Yeah, to the patient
Hand,
jargon.
I mentioned hand and legs.
Hand and legs
Legs
or
are
arms and legs.
yes.
Yes.
Arm and legs. Okay, okay, okay.
Okay,
Okay. What
and
else? What else? Jargon. What else? Tell me.
you mentioned hemoptysis as well to the
Ah,
patient.
okay.
Yes, and there was a fourth thing you said, but I do not remember now. Regarding the smoke, you as well, because this is a patient with hemoptysis, a smoker with weight loss, then you need to dig a bit about smoking, like ask him how long have you been a smoker, and how
How
much
many
did
cigarettes
you
per day?
smoke it, how many cigarettes per day, because it was quite significant, and on examination there was also nicotine stains, there was tar staining.
Mm.
uh,
So you want to say it's borderline or satisfactory in the
I think
clinical?
these are like minor minute things. These are minor things, so
So
I would
it's
go
still satisfactory, you want to say?
with satisfactory. But just like
Okay.
this is for like a feedback, like for future practice, because
Yeah, by
we
the way,
kept being
if
overwhelmed,
you
I
give
think.
her if you give her now borderline, better to be motivating, to be satisfactory in the exam. Okay, so
Okay.
it's
Yes,
yeah,
better
no
tell me
worry.
now what defect.
Yeah,
Yes, yes,
exactly.
yes. I want to know. Yes, I
Yeah.
want to
Yeah.
know.
So I will make the other judgment as another examiner with the same attitude of Dr. Lamis. So I will just multiply the skills by two, and I will tell you the marks at the end. Okay, just to be aware
Right.
about the marking system. Okay, continue, Dr. Lamis, about the marking.
Right. Okay. So, in terms of the clinical judgment, um, so I think with the clinical judgment and the differential diagnosis, I'll put a borderline as well because the whole vasculitis things was supposed to be among the differential, and it hasn't been addressed.
So it would be another
Dr. Lamis,
borderline.
can you tell me more about this vasculitis?
Yes. So
Because it look like
your
I missed this one in history.
yes. Okay. So regarding your vasculitis, it is because the patient had hemoptysis, and he has some fever. He has some body pains, arthralgia. When you ask, he said, I have aches all over my body. He had fever. He had weight loss. And if you look at his blood pressure as well, it's on the higher side. So this is one of the differential is granulomatosis with polyangiitis, which is the Wegener granulomatosis.
Yeah.
So this has been one of the differentials in this case. And although he did not say he had any waterwork changes, but still you need to put it in your mind.
Okay.
Also, Wegener granulomatosis can present with lung cavities as well. So there isn't anything that excludes it from the history. Okay.
Yes. Okay, thank you.
Okay.
So the
So
differential
What
also
else?
will be borderline or satisfactory, you want to say?
I'll put borderline because the case was calibrated for vasculitis as well. Even though the diagnosis is correct, it is aspergilloma, but also vasculitis and lung cancer were the calibrated differential diagnoses.
The last two skills, concern and welfare. Did she
Yes,
address all concerns
yes,
and she
yes,
maintained the
both.
welfare?
Yes, both were satisfactory.
Satisfactory. Okay. As I said, if you want to get a mark here, will be, just give me a second. Satisfactory, concern will be 4, welfare will be 4. So this is 8. Then 2 for the differential. 10, 12 for the clinical judgment, 12. Then 4 again for the clinical communication, 4 plus 12, 16. Plus satisfactory identify, 20. Borderline physical examination, 22. Okay, assuming the other examiner the same attitude of Dr. Lamis, which is kind, by the way. She give you good in most of the skills. Okay, Dr. Salma. Yeah,
Okay.
I try
For
to just simulate because some of the candidate doesn't know how to judge and how to calculate about the skills and the marks. I hope it will be beneficial for all of you, particularly the candidate who's going to the exam near.
yes, 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 sure.
Yeah. Okay.
This is
So
very important. Huh?
what week you have to improve
Yes, yes.
based
We are
on
here to
this skill?
improve
Yeah.
our.
Yes. Exactly.
Yes.
Okay. Let's talk about the topic, Dr. Lamis, quickly.
Sorry, I have one question. For concern, what I didn't mention for concern.
No concern, you covered
What
well.
should I what
You-
should I tell to the patient to get يعني,
Okay.
uh,
As
satisfied?
advice, don't give him possibilities. If he asks you, do you think, doctor, is it another thing? Yes, you can say, okay, but try to give him one possibility. Okay,
Okay,
because he's
okay.
not examiner and he will
Yes.
not care about other possibilities. Some of them, yes, he might care. He will tell you, doctor, what could be? Is it a cancer? Okay, you can say, what really, or to be honest, the cancer may be one of my list, but maybe at the end of my list down in this way. But don't tell him, sorry, I have another differential in my mind. Okay, whatever you want to mention as a clinical judgment or differential, the examiner is happy to hear all of them. But the patient will not care whatever you are giving as a possibilities. He needs one possibility, maybe the diagnosis or not. Even, by the way, even if you didn't give him the correct diagnosis, and the clinical judgment will not be on the concern. Okay, unless you mention
Okay.
something wrong. But if you address the concern properly, you will get the mark for the concern, whatever the diagnosis, even if you didn't mention the name. If you don't know yet the diagnosis, you can tell him, I have some possibility, I'm not sure. It could be related to certain disease. I would like to run some blood test and to confirm the diagnosis. Then I will be updating you. By this way, you can get the mark. No need to mention the correct diagnosis to the patient. You got it?
Okay.
Yeah.
Yes.
Okay. Dr. Lamis, you want to add anything for the topic itself? So aspergilloma, you want to say this is a case of aspergilloma
Yeah,
based
this
on
was a
what?
case of carcinoma. So
Yeah.
based on the previous history of tuberculosis and
The, Dr. Lamis, some breaking
also
in
the
your,
patient has tumor as well.
yeah, if you can sit in
Sorry,
good,
but I'm sorry, I'm
yeah.
using a headset.
Yeah, try to be
Is it
near to
better
the
now?
connection. It's good sometimes at breaking others.
Right, okay.
Okay, now it's okay. Yeah, you
Okay,
continue,
sorry
please.
about that. Okay, so this is a case of aspergilloma. The patient, he has some risk factors. He had previous history of tuberculosis, and he's also a farmer, and he has been having some constitutional symptoms. Also, on the examination, he had a cavity in the lung, which also favors a aspergilloma. And the hemoptysis as well. One of the other differentials were CA lung, because the patient has also been having hemoptysis, weight loss, and he has some long history of smoking. So that's one of the possibilities. And also he had also the vasculitis among the differential diagnosis as well. Although Dr. Selma, she asked about bleeding from other sides, she asked about any bleeding from your nose, but always to cover the vasculitis, ask about any blocked nose, any crusting in your nose, just to cover the other symptoms for the vasculitis.
Okay.
Perfect. I would like also to add some skin rash will be associated if you suspect vasculitis. You might have also neurological manifestation. Okay.
Yes.
Yeah, meningitis multiplex sometimes, or any vasculitis association like hematuria and joint pain. I agree with Dr. Ala. His comment is really good. You have to have another finding, but you have also to rule out it. Don't say it's not because the symptoms are not there, but you didn't ask them, or you didn't ask about them, how you rule out them. So in order to rule out vasculitis, I have to ask about the manifestation of vasculitis.
There was joint pain.
Sorry.
He said, I have joint pain and I have aches all over my body
Yeah,
as
so
well.
you can say in favor of that, I can suggest vasculitis. Okay. Other than this, the rash, and I agreed to ask about deformity or stiffness or blockage of the nose. I would like also to add a question for the breathing, any noisy breathing. Okay, for eosinophilic granulomatosis polyangiitis, which is also relevant system question. Noisy breathing or wheezy, supposed to say noisy breathing, not wheezy breathing, but I mean for asthma-like features, which is associated with eosinophilic granulomatosis polyangiitis, Churg-Strauss formally. So you have to rule out, and based on that, I will say this or that. Even if you ask the question and the patient told you, I don't have, I don't have, I don't have, here, if the examiner suspect that you didn't put it in your differential and he asks you, now you can say to the examiner, doctor, I asked him this and he said no, he denied that, he denied this. So in order to have good differential, I have to rule out them either by questioning or to mention to the patient, to the examiner, that I could think about this if he has that. I hope it's clear for all, right? But usually, whenever you have hemoptysis in young patients, you can suspect a GPA, granulomatosis with polyangiitis. By the way, if the case is with deformity and you didn't see a patient, maybe the surrogate is there, and you didn't ask clearly about this deformity, you might lose the case. Okay? But good thing here, Dr. Salma, she got there is previous history of TB, but I would like to ask, or I prefer to ask about the TB, previous TB more. Any surgical,
Okay.
any admission, any hospital, what medication. Don't take these things lightly. Maybe something was there as a clue. If you didn't explore them, you might lose the case. And definitely, whenever you have previous history of TB or any disease, you have to suspect the recurrence of this disease, which is good. The aspergilloma, yes, because he's farmer. And you didn't ask also what type of farming you are doing. Is it birds related or just plants? Try to pay attention to those things which is positive in the history. Don't take anything lightly. Even the smoking here, you didn't ask how much, for how long, which also doesn't make sense that you can put cancer because I didn't ask about the smoking. How many cigarettes? Maybe he's not heavy smoker, he might be ex-smoker. since you know the amount, you can give a differential of cancer, right? So anything positive, don't take it lightly and just overcome or overlook it. You have to ask more about it. Clear?
Okay,
Yeah.
yes.
You want to add anything, Dr. Lamis? Okay, let's talk about the clinical part or clinical point of view for aspergilloma. I think Dr. Lamis mentioned. You want to add anything, Dr. Lamis, or
No, I don't have anything to add.
okay? So what are the investigation for aspergilloma? As I usually start, general, specific, bedside, and imaging, invasive. Don't rush to the, for example, the specific. You have to rule out the other manifestation or the other investigation or to check for the other investigation. What's important here in the general investigation, and you have to mention Dr. Ramis and Dr. Selma. Let's ask Dr. Selma first. Very important thing you have to ask, and it's also important to ask in the patient or to find out in the patient while examining him. Not only with hemoptysis, with any patient having bleeding, what I should ask, what I should examine. It's a general question for you or anyone.
Any
Amount
type
of
of
bleeding?
bleeding?
Okay,
Yes.
we finish the amount, finish everything. Even the amount is light or small amount, but for long time. What I expect to have.
Any bleeding from other sites, any blood thinning medication.
Yes, you ask, I mean, in the complication of bleeding, in the term of complication of previous bleeding, long-term bleeding,
Any
what I could.
anemia?
Anemia.
Exactly, yes.
Yeah.
Dizziness and standing from sitting position, one of the important manifestation
Any
which can
postural
give
drop
me
in the
a
examination?
sorry?
Any postural drop in the examination?
Yeah,
Any
so
palpity?
either pallor and jaundice, not jaundice, let's say pallor or bushra hypotension in the examination, and in the history, I would like to add the dizziness. Do you have any dizziness? Anyone told you you are paler than before? 2 months bleeding, even little amount, supposed to have iron deficiency anemia or microcytic hypochromic anemia, right? I should explore it by one question here and examining this sign there in the examination steps. It's very important during, I can put it in the constitutional symptoms with any bleeding. You might have hemoptysis, you might have hematuria, you might have bleeding from any other orifice. And good thing also, Dr. Lamis, Dr. Selma asked about any other bleeding. It's very important. The amount, of course, you have to ask, but I'm talking about the manifestation of anemia. Was it there or no? Okay,
No, it wasn't there because she asked for the pallor when she wanted to examine the eyes, and I
perfect.
said there is no pallor.
Perfect. So I either in the exam, not either, I should do both of them in the examination steps and in the history. Let's go to the investigation. What should I add in the investigation in order to pick up the anemia?
Anemia, full blood count?
Exactly. So I can't say general investigation, and I can specify one important here. I would like to rule out anemia and the differential cell count. For what reason? To know what type of anemia, right? And what
Yes.
expected here? What type of anemia expected?
A hypochromic microcytic anemia, full
Yes,
blood.
exact. Perfect. What else I should do as a general investigation, which also could be related to the case?
CT.
No, 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 no. Wait, please. Don't mention imaging now at all. I'm talking about investigation.
Okay, general. Oh.
Laboratory. Laboratory. What other laboratory baseline investigation I should do?
Yes, we would like
Coagulation
to do.
profile.
Inflammatory marker?
No, no, no. Coagulation profile,
Okay, okay, okay.
right? I should rule out
Yes,
any coagulopathy. Okay,
yes.
I will give you real exam, not real, sorry, real practical case. We have faced it last week. And unfortunately, we couldn't help this patient. And it came with gingival bleeding or gum bleeding. Imagine the
Mm.
scenario. I will tell you it's real, really, it's real case scenario in my practice in ICU. Young female, 47, presented for 2 months with gum bleeding, bleeding per gum. This patient had dental surgery before, artificial teeth, and she went many times to the dentist looking for the reason of the bleeding. Okay, till now it's okay.
Mm.
2 months, no one did for her coagulation profile or any lab workup, even though she traveled to Egypt to do repair or to do some, because she did the teeth there, the artificial teeth there. So the dentist here advised her to go to the team or the previous team who did this for her, previous dental procedure. And she presented to us last week after she finished the flight, and she came back with vague symptoms, tummy pain, short of breath. She was admitted to the ICU, and the problem, the bomb was there. Patient is having severe anemia, severe thrombocytopenia, coagulopathy INR 4.8. And the other bomb was this patient is having, what can think about the case? Anyone can think what could be the case? Bleeding, thrombocytopenia, anemia. Then she had,
ITB.
it's similar, like, it's similar to ITP, but it's not ITP. I mentioned anemia,
DIC.
thrombocytopenia,
DIC.
coagulopathy.
DIC.
AML.
Perfect. Who said it?
Is Henry.
Dr. Henry. It's acute
Yeah.
myeloid leukemia. Patient had leukocytic count initially was okay, but next reading was 55,000. And the patient went into severe pneumonia because of immunosuppression now. She has blast cell more than 45 in the blood count, sorry, in the blood film. Intubated ARDS and already tried to resuscitate, septic shock, multi-organ failure, severe acidosis, hyperlipidemia. And in 2 days, patient passed away. It's single and very simple test to do, blood coagulation or CBC. No one of the dentists thought about it, as well as the family didn't ask or seek medical advice, and fortunately, patient passed away. I'm talking about simple and single test can help the patient see for the difference you can offer or the service you can offer to this patient if she has early diagnosed 2 month bleeding per gum. No one think about coagulation profile. What I want to say, don't overlook the coagulation or anemia. Even the examiner doesn't want to hear the general investigation, but you can pay attention to those blood workup. It might help in this relevant differential. So in bleeding, I should do PBC, I should do coagulation profile, right? What else I can do? As you mentioned, inflammatory markers to rule out infection, and the specific here will be as
Our we're going to do our chest X-ray, our
no,
HRCT,
no, yeah,
CT
always mention the tool under the category. So in CT and chest X-ray, is it
imaging.
specific?
Imaging.
It's
Yes.
imaging. So let's talk about the specific investigation or laboratory investigation. Specific here, you will do CBC. You will do AFB, right? For TB, you will
Yeah.
do TB
When we do
workup.
not.
You will do the vasculitis workup, C ANCA, P ANCA, antinuclear antibody, all antibodies you want to mention, and you have also to suspect the aspergilloma. So I would like to do fungal culture, right?
Yes, culture and serology.
And serology. Yeah, now we will go to the bedside test, ECG, echo, to rule out anemic heart failure or to rule out any cardiac issue. The urine dipstick, for example, if there is peripheral neuropathy or any amyloiditis multiplex, I could do the nerve conduction study. If there is joint pain, I would like to do a joint aspiration if there is. I'm talking about every investigation or what I can add to my plan. Okay. Now the imaging. Starting by
The chest X-ray.
perfect. Don't say I will do it RCT first. I have to do the simple and the easy test, which is chest X-ray. It might show me cavitation or it might show me capacity, apical, or whatever the location. Whenever I have these, I will proceed with the high resolution CT chest or even CT angio if there is massive bleeding or hemoptysis to localize the bleeding site, right? What is the investigation as invasive one in this scenario? Dr.
Any
Lamis.
bronchoscopy. Yes, any
Perfect.
bronchoscopy.
Exactly. Bronchoscopy for bronchoalveolar lavage to rule out, to do some sputum, or if there is no sputum, I can get more accurate sample from the bronchioles, right? TB, PCR. I would like to do the fungal culture. Anything you want to add, you can do it in the bronchoscopy. Yeah, I think we covered the topic. Yes, the last thing, whenever you are talking about management, multidisciplinary team, I have multi-system affection, the lungs, the hematology, the anemia, and always start with ABCD whenever you have something could be affecting the circulation or the hemodynamics. ABCD, patient is having, if this patient presented with massive hemoptysis, I couldn't wait for another team to come, right? I have to start my resuscitation ABCD approach, the saturation, the blood pressure, blood transfusion if there is severe anemia, other blood product if there is coagulopathy, right? Then I can start with multidisciplinary team if the patient stabilize, pulmonologist, thoracic surgery, don't forget them. They might be also interfering here, as well as the radiologist, IR, intervention radiologist, specialized nurse, respiratory therapist, and so on. In particular, the aspergilloma or aspergillosis as a management supposed to be antifungal in the form of anti-itraconazole. Something will be IV, right? Cannot give oral here. And the definite management, as Dr. Lamis mentioned, will be resection of this ball, right? Resection of the ball or lobectomy, or it depends on the source of bleeding. If I could control or no. If I could control with the semi-invasive, I can do the intervention radiologist embolization, right? If I couldn't do up to the lobectomy, sometimes pneumonectomy, if I couldn't control the bleeding, the source of bleeding. Clear for this topic and this case? Anyone want to add any question or comment? Dr. Lamis and Dr. Salma in particular?
No.
Thank you.
Yeah.
Thank you
Anything
for
you want to
that.
add? You prepared the case, Dr. Lamis. Anything missed?
Okay.
Yes.
Is the scenario posted yet?
Yes, posted
No, no,
maybe
no.
before.
I'm talking about the first case. You want to add anything missed?
No, I don't have anything to add.
Okay. Yeah.
Yes.
Okay, so let's read your
I
topic,
think
your case scenario. Mrs. Layla, 32 years old with a complaint of weight gain, fatigue for the last 3 months. After delivery for your kind care. Okay, after delivery. She's postpartum.
okay.
Quickly, I will try to read the comment. Anyone want to add any question or comment? Okay, let's go quickly to the comments in the chat box. Yeah, as I said as an advice, prepare yourself to give three differential. Don't say my differential is one, then you will think about second, then you will be taking long time to think what other third. Get ready to give three differential to the examiner. Okay? If he find that you give him only one and you are thinking, of course, he will minus you on the differential skills or differential diagnostic skills. So get ready to give three differential at least. He might ask you about what else? What else? If you couldn't mention the case or the diagnosis, the correct diagnosis. But if you mention it, he will add. Who for he will wait for you to add two more differential. But if not, he will wait till you mention the differential, the correct diagnosis. Okay. Doctor, starting by Dr. Ala, post TB, yes, cancer, okay, TB, malignancy, Dr. MRCB, aspergillosis, Dr. Samira, sorry, aspergillosis, TB, reactivation, lung cancer, bronchiectasis, perfect. Bronchiectasis, you have to think about bronchiectasis. Bronchiectasis,
Dr. Salma, she mentioned it in the differential diagnosis.
sorry?
Dr. Salma, she mentioned bronchiectasis in the
Yeah,
differential
yeah,
diagnosis.
perfect. I'm repeating these
Yeah.
in the chat box. Try to find, yes. Recurrence, Dr. Rihan Mansour, recurrence TB, aspergilloma, lung cancer, cancer, lung. Wigner, Dr. No name. Yeah, he's the only one mentioned Wigner as a differential. By the way, hepatorenal, sorry, not hepatorenal, pulmonary renal. If you have any patient with pulmonary renal, put in your differential the Wigner in your top differential. Okay, GPA, if you have hematuria and hemoptysis. But not in our case today. There is no hematuria, so I couldn't say this is my top differential. Dr. Ala, I agree with this comment. I didn't think Wegener because, as a first, yes, no upper respiratory tract symptoms, no kidney problem, no skin rash, no joint pain, perfect. Chest X-ray, drug, aspergillus spartis, precipitate, chest X-ray, drug. This as investigation. Warfarin, yeah, she asked any blood thinner, which is good question. Blood thinner, she asked about MACI. You mean iron deficiency anemia? Yes, okay. This is the second case. ITP, Dr. Ashema, Vonwell brand. No, it wasn't. ITP or TTP, it wasn't. Aspergillus precipitant, yes. Embolization, perfect. Okay. So we talk about all the things. It was nice case. Thank you, Dr. Anis.
You're welcome. I'm ready to start. Dr. Salma.
Perfect. Yeah, here you go.
Okay.
Yes, you can start.
Okay. Hello, my name is Dr. Lamis. I'm one of the doctors in the clinic today. May I confirm you're Mrs. Lilia and you are 32 years old?
Yes.
Hi, Mrs. Lilia. I'm here to take some history from you and I will be examining you. Is this okay for you?
Okay.
Okay. So, Miss Lilia, can you tell me what have brought you to the hospital today?
Uh, After delivery, before 3 months ago, I noticed that my weight is increasing, and also I feel uh, fatigue, like body pain, and I
Sorry
feel
for
also tiredness.
I'm sorry to hear this, Miss Lilia. So can you tell me more about your delivery? You said it has been 3 months ago.
Yes,
Was it
it
a
is.
normal
Yes,
delivery or
normal,
was it an operation?
normal.
It was a normal. And did you have any excessive bleeding during your delivery?
Uh, no,
Okay. And did you receive any blood transfusion?
no, I didn't receive any blood transfusion.
Was your recovery was it smooth after delivery?
Normal, spontaneously.
It was normal, okay. And
Yes,
were you able to lactate your baby? How's your
yes.
right, okay. And other than that, you've mentioned you have some increase in your weight. Can you tell me more about it? Did it
Only doctor, I noticed that my weight is increasing quickly, and also I feel like a low mood and also fatigue, as I mentioned to you, and tiredness.
Right. I'm very sorry to hear this. So regarding your weight, the increase in your weight, is it all over your body or in specific areas like your tummy?
No, all over, all over.
It's all over your body. Right. Okay. And it happened around the same time, 3 months
Yes.
after you delivered.
Yes.
And may I know how much weight did you gain?
I didn't check, but I noticed that it too much increasing, even noticed by the other.
Right, okay. And also you've been feeling more tired. Is this correct?
Yes.
It also happened around the same time in these 3 months.
Yes.
Okay. And is it all over the day or more around a certain period like the evening or maybe sometimes early in the morning?
All over the day.
It's all over the day. And is this affecting your care for your baby and your daily activities?
Yes.
Right, I'm sorry to hear this. Okay. And may I ask you if you have any trouble with sleep?
Sleep?
Yes.
No, doctor. I'm sleeping, but
You're
I
sleep.
find some difficulty when I get up from chair or
Okay.
when I'm combing my hair. I find difficulty.
And do you have any weather preference?
Yes. I feel cold
You
intolerance.
you feel cold intolerance. Okay. And have you noticed any increase in your body temperature?
No, no,
Any sweating?
no.
Any lumps or bumps?
No, no.
Okay. Any change to your bowel habit? Any hard stools?
Yes,
Really?
yes, doctor. Uh, I'm facing hard stool.
Right. Okay. And any tummy pain?
No.
Okay. Any acid brush?
What?
Any heartburn or any acid brush?
No, no, no,
No. Okay. What about your waterworks? Any change to your waterworks?
no, no. Normal.
Okay. What about your skin? Have you noticed any skin dryness?
Yes, I feel my
Okay.
skin is dry.
Is is more dry. Okay. Any rash anywhere or any changes?
No, I didn't notice any rush.
Any problem with your joints?
No, only as I
Any
mentioned to you, fatigue, water, my body tiredness, all my body, but
right?
no
And
specific
you
joint.
said you have the muscle pain you feel when you comb your hair.
Yes,
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 you get up from the chair. Okay. Um,
yes.
do you have any dizziness standing from the sitting position?
No.
Okay. And has anyone told you snore at night?
What?
Have anyone told you snore at night?
No, no,
Snoring.
no one.
Okay.
Yes, no
And
one.
do you have any pain in your hand that any tingling, any numbness or pain in your hand that gets better when you shake your hand?
No, no, no.
Right, okay. And may I ask you if you have any past medical condition I should be aware of?
Before I am okay, I have nothing.
You have nothing, okay. And are you taking
Yes.
any medications now?
No, only some vitamins prescribed by doctor after delivery.
Right, okay. And do you have any family history of gland problem?
No, no, I didn't notice.
Okay. Any family history of significance? Any high blood pressure? Any high blood sugar?
No, no, no.
Okay. So ask you a few questions if you don't mind. What do you do for a living?
I am teacher.
You're a teacher, okay. And how are these symptoms affecting your job and your daily activities?
Yes, doctor, affecting me too much. I'm suffering because always I feel fatigued, tired.
Right, okay. Sorry, I'll try my best to help you. May I ask you if you smoke or drink alcohol?
I smoker.
Okay. And sorry to ask you, did you have your period yet after delivery?
Period?
Yes.
Yes, yes.
Any problem with the periods?
Yes, it's coming after delivery, but uh, sometime come, sometime not come, like this. I
Okay.
feel it is I feel it is irregular.
It's irregular, okay. And are you
Yes.
on any birth
Sometime
control?
I notice excess bleeding. Sometime.
Okay, so sometimes you notice some excessive bleeding. Okay,
Yes.
are you on any birth control?
No.
Okay. Sorry to ask you this. Do you have any problem with the intimate relationship?
No.
Oh, right, okay. Sorry, Miss Lily, I'd like to ask you, have you experienced any headache?
No.
Okay. Any weakness in your body?
No.
Okay.
No
Uh,
weakness.
right, okay. So I'd like to go ahead and examine you, if you don't mind.
Okay.
Okay, so I might ask you a few questions while I'm examining. So I'd like to start the examination of the patient by looking at the general look. I'd like to check the BMI of this patient. I'll start with the pulse and the blood pressure, and I will look for any postural drop. Then I'd like to check the palms for if they're like dry or if they're sweaty. Then I will go and check for any proximal myopathy. So I'll ask the patient to stretch her arms, and then I will push to check the power. And then I will check for any pallor, for any
No pala.
jaundice. Okay.
No jaundice.
Uh, no jaundice. Then I'll ask the patient to examine her, take permission to examine the anterior neck. Um,
Okay.
okay, so is there any swelling in front of the neck?
Yes.
Okay, so I'll get a sip of water and I'll ask the patient to swallow to check for any swelling.
Okay.
And then I'll ask the patient to again
Move
take a
with swallowing. Yes.
yes, to check if it also moves with protrusion of the tongue. And then I will ask for permission to examine the patient from behind and palpate the thyroid to check what kind of swelling, whether it's a nodule or if it's a diffuse enlargement.
Yes, there is diffuse enlargement of the thyroid with a
Right, there's a
mild tenderness.
right, okay. Um, right, so I just wanted to ask about the pain. Is there any pain in your neck?
Yes, there is mild
Mild
pain
pain.
on over
Right,
this swelling.
right, okay. And I'd like to palpate the lymph nodes as well.
Okay. No, no
Okay.
lymph node enlargement.
Okay. In the pulse, was there any bradycardia? What was the rate?
Um, Normal, everything normal.
Okay. Okay, so I'd like to also just auscultate the heart, S1, S2. Then I would like to examine the knee for any crepitus, and I'd like to check for any slow relaxing ankle reflex.
All normal.
Okay. I also like to check for any carpal tunnel, ask the patient, and I will take permission to examine the abdomen for any organomegaly.
Okay. No organomegaly.
Okay. Right, okay. May I ask you what's your concern, Miss Lilia?
What?
May I ask you about your concern?
Yes, what I have, doctor?
Right, okay. So from the history and examination I have taken from you, Miss Lilia, I think you most likely have a condition called postpartum thyroiditis. Have you ever heard of it?
What is this condition?
So it's a condition that is related to your thyroid gland, which is the gland in front of the neck that I have just examined. So sometimes after women give birth, there are like some changes happen where temporarily this gland becomes inflamed and sore, and it gives you a bit of a pain because of the low hormones of this gland.
Two
It gives you
minutes left.
yes, it gives you some symptoms like feeling tired, gaining weight sometimes, also having this difficulty combing your hair or having weak muscles. But don't worry, for that we will have a team of doctor, including the gland doctor, specialist nurse. We will run some blood tests to check for the gland function. We will do also a scan to check the front of your neck and anything you might need. And after that, we will give you the appropriate treatment.
Okay, is it serious, doctor?
Right. Yes, if symptoms are not controlled, could get serious, but don't worry, it's a controllable condition. When the gland is underactive and the hormones are low, as I mentioned, we give you some replacement hormone, and this gets the balance back of your gland.
Okay, I can be treated from this
Yeah,
condition or will be long standing.
right. Okay, I appreciate your concern. In most of the cases after delivery, they can have some complete recovery, and in a smaller number of people, then women may require some lifelong treatment with some tablets that replace the hormone of the underactive glands. And in some other cases, you may recover, but there's also a risk of recurrence in other pregnancy. But for that, we need your pregnancy to be planned, and we will involve the women's doctor and the gland doctor, so they will give you the right advice and the right treatment.
Okay, thank you, doctor.
Time is up.
Okay.
Yeah, examiner question.
Okay.
Can you present your case?
Right, okay. So Miss Lilia, 32 years old, female who has been complaining of tiredness and weight gain for the past 3 months following her delivery. Her delivery was normal, and she did not have any excessive bleeding nor needed any blood transfusion, and she was able to lactate. She has symptoms consistent with hypothyroidism in the form of fatigue, weight gain, hard stools. She also had some dry skin and features supportive of proximal myopathy, and her past medical history is unremarkable. On examination, the patient's weight was on the higher side. She had a diffuse thyroid enlargement, which moved with. She had a diffuse thyroid enlargement, which was slightly tender, and yeah, and proximal myopathy.
Okay. What investigation will do?
Okay, so in terms of investigation, I will do baseline investigation in the form of a full blood count, inflammatory markers, ESR, CRP, urinalysis, urea electrolytes, and liver function. I also want to do a fasting lipid profile for this patient, and do hemoglobin A1C then specific investigation in the form of a full blood count and a thyroid ultrasound. I would like to do thyroid antibodies in the form of anti-thyroid peroxidase antibodies. I also want to evaluate for any complications. I'll do an ECG, echocardiography, a chest X-ray. Okay.
Okay, what is your differential?
My first differential is a postpartum thyroiditis. It could also be Hashimoto thyroiditis. It could be Sheehan syndrome, but again, is that the patient did not have, apart from hypothyroidism, but just because it was happening after delivery, and I excluded any blood loss, any failure of
Yes,
lactation.
no problem. Okay.
Yeah, so it could be yes.
Okay, thank you, doctor.
Okay.
Thank you.
How to manage?
Doctor. Okay, how to manage?
Right. Okay. So, in terms of management, education and counseling of the patient, assessment of thyroid function. We will, if the gland is hyperactive, then we will treat with levothyroxine. And if the patient mentioned she had also low mood, then if she needs like any support with the baby as well, then weight management advice regarding a balanced diet, gentle exercise, and check for any complication, and we'll recheck the thyroid function after 6 to 12 weeks.
Okay. You will check thyroid function and check which phase, because this is sometimes
Yes,
postpartum thyroiditis is swinging between hyper and hypo.
and hypo,
Okay.
yes.
Yes. Accordingly. Okay.
Okay, I will
Do
add
you
one
want
question. Yeah,
something to add?
yeah. How much the percentage the patient will have recovery and how much they can have permanent hypothyroidism?
All right. I think so around 70% of the patients they recover. And we have 70 to 80% they have complete recovery. Around 10 to 20% they may have permanent hypothyroidism,
And
and even the
require.
patient, yes, and even the patients who recover, they might have a risk of recurrence in their subsequent pregnancies.
Perfect, perfect, doctor. Really, it was wonderful. Thank you, Dr. Lamis. Dr. Salma will comment now. Again, based on the skills, I will write them down. You can start, Dr. Lamis. Dr. Salma, sorry.
Uh, uh, Perfect. Good. But only I feel that about female history, didn't ask about misabortion.
Yes,
Bills
yes. I was not
need
asked
to
about
ask
any
more about female history in this situation. This is only I know.
So, physical examination, did she cover all steps of physical examination?
No, because need to also auscultate and need to percussion for
Perfect.
retroperitoneal if there is any retrosternal thyroid.
Yeah,
Extension,
And
yes. Perfect.
yes, it is.
So, physical examination, is it satisfactory or borderline?
I think it's a borderline.
It's okay. So, we
Because
will
yes,
put.
at the end, after I completed everything, I just remembered that I did not auscultate because
Yeah.
she had diffuse, particularly that she had a diffuse swelling. I had to auscultate.
But really, you did it well as examination step. You remember even the ankle reflexes, which usually or mostly will be forgotten. But you remember it. Okay, let's go to the other skill, which is a physical. Identify the finding. Dr. Salma,
Yes.
did she identify all findings?
Uh, I think yes, because me also I'm not experienced too much to evaluate anyone because still I am crawling.
And I
So,
think
but I think it's doing good.
mostly
Well, it's doing very good. يعني what I
Okay, satisfactory. You,
yes,
you want to give here and they identify. Okay.
yes, yes.
I will add only for the finding the eyebrows, loss of eyebrows, outer third. Okay. You can add it to your approach next time. So satisfactory here means 4 marks again. Okay. The next will be clinical communication.
Yes,
How much you
satisfactory.
can give? Satisfactory.
Full mark.
Yeah. Okay. The clinical judgment.
Mm, full mark.
All marks. And differential diagnosis.
Also very good. Okay, full mark.
Satisfactory all. So
Yes.
you will just minus in
Only will minus in examination.
examination means she will get 26 out of 28, right?
Yes.
Perfect. Okay.
Yes.
Other comments you want to add regarding the topic postpartum thyroiditis? Dr. Selma?
Uh,
Anything she missed in the investigation, in the imaging, specific, general?
I think other antibody mentions that TBO only. Need to do another TSH also.
The other, which is?
TSH antibody.
Okay.
Yeah, in full term, please.
Um, thyroid stimulating
No, no, no.
antibody.
Thyroid
What do you
stimulating
mean?
will be
I didn't understand.
with Graves, I think. It's not.
Graves, yes.
Yeah, by
Graves.
the way, it's. Yeah, here also, I think the TPO will be positive in Hashimoto, right?
Yes.
Is
Yes,
it
and
is
it could
is it
also
positive?
be positive.
Could be positive in the postpartum, right?
Yes, but mainly it's the Hashimoto. So I this brings me to a question I had regarding the differential diagnosis because in the differential diagnosis, so when I think of the whole picture, I feel like the Sheehan is worth mentioning because of the delivery, but again, I also sometimes feel it should be um, it should not be there. Like she had two components, like she had low mood and she had the hypothyroidism, but she did not have like any dizziness standing from sitting position, suggesting like the ACTH affection. Is it still wise to keep it in the differential diagnosis?
Yes, as postpartum complication, you have to mention it. As you
Okay.
mentioned exactly, against that, the patient is able to lactate. She doesn't have other features of pituitary dysfunction in the form of addison, in the form of the thyroid, and in the form of amenorrhea. She has here menorrhagia, right? It's not amenorrhea. Sheehan patient will have amenorrhea,
Yes,
right?
amenorrhea, yes.
Yeah.
Yes.
So you can say that, and as a complication, but you can say again if that patient doesn't have a complicated or eventful delivery or bleeding during delivery. Okay, and the other, sorry, other manifestation of the other hormonal deficiency.
Okay.
Sorry, continue, Dr. Salman.
Uh, yes. I think that is good. Uh, Dr. Namis, what for treatment? You mentioned everything.
Yes, so
Okay,
I
as
mentioned
yeah,
Is
everything.
there any medication? Medication can be given.
only a hormonal replacement. Yes, as she said,
Thyroxine.
and
Okay.
yeah, in case of hyperactivation or hyperthyroidism, you can give the anti-thyroid medication,
Yes.
right? Don't forget the thyroglobulin antibodies. It's one of also of the antibodies to be done.
Okay.
The imaging, you mentioned the ultrasound, right? And the
Mhm.
invasive will be
Fine needle aspiration cytology.
perfect. Yeah. I also iodine isotope scan. It can be done, but do you think it's suitable to do it?
No, because she's lactating.
Perfect. Yeah. Okay.
Dr. Miss, for differential, you mentioned postpartum thyroiditis. What is the next one?
Hashimoto.
Hashimoto.
Hashimoto
Hashimoto.
thyroiditis.
Then
I mentioned Shihan.
Shehan. Okay. Okay. Okay.
I also, because she had a diffuse thyroid enlargement, but she had obviously hypothyroidism. Can the hypothyroid phase of Graves' disease be kept in the differential diagnosis? But usually, like the hypothyroid phase doesn't happen like in the beginning. It usually happens after some time of being
Ye-
hyperthyroid.
Okay. When you mention Graves, Dr. Lemis,
Yeah.
as a term, I am asking you as a question. When you are saying this is a Graves patient or Graves disease,
So this is usually for a diffuse thyroid enlargement with features of hyperthyroidism associated with eye symptoms.
perfect. Since you are not having eye symptoms here, you cannot say this is a Graves.
Okay, but
You can say hyperthyroidism, but you cannot say it's Graves unless you have eye symptoms, exophthalmos.
okay.
All
But
right.
sometimes some patient of Graves they don't like in the beginning they don't develop
Yeah,
eye
and
symptoms.
perfect. But if you want to add, you can and put another differential. By the way,
Yeah,
it's
because
not Graves.
just if they keep asking like what else,
Yeah.
so
So
I
give
was
me what
thinking of
else?
something. Yes, I am thinking. I'm asking what else can like combine the thyroid, the
Yeah,
picture.
there
Yeah,
is another condition which is preceded by infection and it can present with hypo or hyper or AO.
okay, it's a decervan thyroiditis.
Perfect, yes. And
Okay,
I think you can add also sensible question here if you ask about any previous infection. You
okay,
don't know what happened exactly the last days. Maybe she had any upper respiratory infection and she is now having this decurvan or subacute thyroiditis. So you can put it in your
okay,
differential. And if you are stuck, you can say the joker of differential or differential of joker or joker of differential. What is it? The joker of differential. Medication induced or drug induced.
yeah, okay.
Okay. Yeah. Patient is
But
not taking medication.
she hasn't mentioned anything.
Yeah. But if she has, you can say it. And iron deficiency. Sorry, not iron. Iodine deficiency also one
You
of the
mean
causes.
medication overuse can cause
No, 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 not medication overuse. Some medication can cause thyroid disease or hyper. For example, the
okay,
amiodarone.
like amiodarone. Okay,
Yeah,
okay,
yeah.
okay. Yes.
Lithium, for example.
Perfect.
Yes, yes.
The last is iodine deficiency can also
I
lead to
think.
hypothyroidism. You have a lot of differential actually, but you have to be more narrow according to your history. Postpartum, what I could have in the top of my differential postpartum thyroiditis. She had as hypothyroid post delivery. You can say Hashimoto, you can say subacute combined degeneration. Sorry, subacute thyroiditis. Okay, subacute thyroiditis, Dickervan syndrome, or Dickervan thyroiditis. Okay.
Okay. Okay.
Any question or comment?
No, thank you.
The good thing here, Doctor, let me remember the delayed tendon reflex or ankle reflex, which is, as I said, usually missed by us, most of us. The complication, yeah, let's talk about complication of obesity, which is good also to remember. You mentioned the obstructive sleep apnea, you mentioned the carpal tunnel, but there is one more.
The osteoarthritis.
Perfect. Always remember it.
Yeah.
The last thing I want to add, the approach for weight gain.
Yes,
As
can be
Dr.
Cushing, can be acromegaly, can be hypothyroidism.
Perfect.
As
But
general, as generally.
what the magic question in this case?
Distribution of
Perfect.
weight gain. Is it
Perfect.
central or not? Yes.
Perfect. So the distribution of weight gain will give you a clue what is the case. In
Yes.
interscapular or the in the face or truncal will be
Cushing.
Cushing. Is it in the hand and the feet and the facial expression will be hand size,
Uh,
feet size,
acromegaly, acromegaly,
acromegaly. Is it distributed all equally?
hypothyroidism.
Hypothyroidism, yes. And of course, you have to have other finding of acromegaly in the form
Yes.
of sweating, hypertension, hyperglycemia. Other features of Cushing, easy bruises, hypertension, hyperglycemia as well, period disturbance, and striae in the abdomen. So every case will have the clue or the specific manifestation. But in general, to approach initially, you have to ask this question: where you can specify the area you gain weight in. She might tell you, yes, in my tummy, doctor. So you can talk about Cushing or polycystic ovarian or metabolic syndrome. If the patient is saying my rings are tight or the shoes being tight nowadays, and my husband noticed my facial expression is little bit changed, you are talking about acromegaly. And the last our case today was hypothyroidism, so all over, and the other manifestation. And by the way, don't say to the examiner patient has a hard stool. You are talking to the examiner, so you are saying constipation.
Okay.
Okay. The other also thing which is very good, you remember the proximal mirror method. You ask and you examine. Okay.
Okay.
How to do the arm abduction and standing from sitting without support. Okay.
The arm abduction.
Yeah, abduction against resistance, abduction,
Okay.
away from
Okay.
the trunk,
Body. Okay.
or and stand without help or without assisting. These are
Okay.
all climbing the stairs as a history wise. Okay. Any question, Dr. Lamis, Dr. Selma?
No.
Thank you very much, Dr. Basim.
It's really perfect session.
Thank you,
Both.
Dr. Salma, for the scenario.
Yes,
Thank you.
it's
Thank you for you.
perfect. Anyone has a question before reading the last comments before ending the session? I will go to the comments, but anyone want to comment? Please go ahead. Anyone want to comment? So the comments, Dr. Samira, Sheehan syndrome, postpartum depression. Okay, but depression cannot cause the weight gain because our presentation is weight gain. Dr. Henry, Sheehan, pituitary adenoma, Cushing, postpartum thyroiditis. Okay. However, adenoma is not unless it's you mean panhypopituitarism, right? Dr. Amal, postpartum thyroiditis, Hashimoto, Cushing, dry skin, Dr. Ala. Yeah, dry skin, pulse, delay, anchor. She mentioned all of them. Really, the examination went smooth and perfect. Autoimmune, pre-tibial myxedema. Okay. Any question or comment from all of you? Satisfied all? Okay, thank you for the practice today, Dr. Lamis and Dr. Salma. Thank you for the attendance, all of you. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Dr. Basim.
Thank you,
Jazakallah
Dr.
khair.
إياك يا رب.